And you're going to be hearing today from Sam Cole with the Colorado Department of Transportation, from Allie Maffey with the Colorado Department of Public Health and the Environment, and from Paige McGowan from the Spokane Regional Health District. So we are all sort of involved in one way or another in public education campaigns, marketing, outreach, that kind of thing. Education is one of the many what now conversations that you have post-legalizations. And we all have had various challenges with tackling how we want to educate our publics about it. In the city, we have taken a particular focus on youth. And any of you who were in the youth prevention and education session yesterday heard quite a bit about the city's sort of two pillars of how we've approached youth education thus far. The diversional programming through our Office of Behavioral Health Strategies that Ed talked about, and then the pro-social healthy lifestyles programming that Molly and Brianne touched on. And those have been incredibly effective programs, and we've seen good results from them, and we've reached a lot of kids that way. But frankly, they are not all that visible to the broader public citywide here in Denver. And so a little over a year ago, we decided that we wanted to maybe pursue a third leg of the youth education strategy through somewhat less depth, but a much broader, more mass media focused campaign to see if we could still have some effective messaging, but reach a broader group of kids in the city. And so that's what we have been working on. You're gonna see some more fleshed out campaigns from these guys that have already been through some iterations and been through the market. I'm gonna talk more about the nitty-gritty development phases of doing a campaign like this, which is what we are neck deep in right now in the city. So what is our goal? We want to take away for kids in the city of Denver to understand that not everyone is using marijuana. There's some misconceptions about that, and we want kids to spark a conversation among themselves to influence one another about what is important to know about underage marijuana use. So as I mentioned, we are in the nitty-gritty of developing this campaign as we speak. And we are primarily targeting 12 to 17-year-olds within the city and county of Denver proper here. Now, seems like maybe a narrow group, but there are unique challenges and different approaches to communicating about weed to a 17-year-old as well as a 12-year-old. So we've got actually a pretty big audience to reach here. And again, as I mentioned, the problem we're trying to solve for is that Denver kids sort of feel like marijuana use is the norm, and in fact it is not. And so we want to, again, have these kids influencing one another to help them understand some of the issues that come up with underage marijuana use and its effects. So the foundation of this is through a few main categories of research. So surveys, most notably the 2015 Healthy Kids Colorado survey, which is administered at the state level in Allie's shop, and provides some incredible insight into kids' attitudes and behaviors about all kinds of risky behavior, but also gives us some county level data that we can dive into here locally. Looking at past campaigns, of course, this is not something that's been around for too long, but there are examples that we can look at from other states and other countries, and lessons learned and takeaways from that. If you need a breather today, I'd Google the Stoner Sloth campaign if you want to see something that we are trying not to do here in Denver. And of course, focus groups, so groups of actual Denver youth who are in our target audience giving us feedback about where we should be taking this campaign. So some of our takeaways from this research has been, again, from that Healthy Kids Colorado survey, realizing that 74% of kids in Denver aren't using marijuana, but their perceptions is that it's closer to half. So again, there's a little bit of a disconnect there. Kids understand that it is illegal to use it, but they maybe don't understand the nuances of the laws and some of the specifics. And again, that sort of developing brain until you're 25, that is out there. Most kids understand that, but maybe not what the actual health effects are. So when we talk about messaging and campaigns and youth-focused marketing, we know that you've got to be real, for lack of a better term. Facts and authenticity is what resonates with this audience. And we also know that we need to create a little bit of tension, and the messaging actually, is going to strive to perhaps make kids feel a little bit uncomfortable and question. That conversation's not going to happen. The conversation we're trying to start is not going to happen without that tension. Maybe obvious, but definitely worth restating is that youth, especially teenagers, want to be spoken to as adults. They have significant influence over one another, and they need time to process these things on their own. So, where are we going with a Denver youth marijuana and education campaign? Again, this is still in development, won't be in the market until December, but wanted to give you all a sneak preview of what we've been working on. So, Denver youth are going to discuss the high costs, and we want them to, again, talk about the health and social risks that can come from smoking marijuana. We want to give them that spark to influence one another through conversation. And of course, we want to create buzz and really, I guess, get those kids to pause and think about, is this worth it right now? Is it worth the potential long-term risks? Any of you who've driven by a high school recently has probably seen some pretty creative fence art. I'll show you kind of a quick example of what we're talking about here. Again, just a really engaging way to get a message across. Again, this is just conceptual, but we're going to draw on the colors and themes of our local schools and use this as a platform for some maybe less traditional out-of-home messaging. Am I still on the right one? Okay, good. Another application of our campaign is going to be a game show called Weed It Out, and we're hearkening back to the remote control days of MTV or Jeopardy, really firing lots of questions at kids to get them talking about what are some real facts about cannabis use, what are some things that they can use as tools, again, to carry that conversation forward and influence one another. There's a take-home version of it that we'll be developing, a classroom in a box, if you will. That's something we can take into schools and other events and have kids use on their own. Again, the same sort of approach with a lot of trivia-style, game show-style questions to get this conversation going. Now, this is all going to be happening over the better part of the next year, and of course, we will have a mandate to evaluate our work and see how we're doing. One of the ways we'll do this is through that survey data. Now, we ran a pre-campaign survey to sort of give us some baselines and try to understand kids' attitudes and behaviors, and we will go back to those questions, hopefully gauge what they learned, not if they learned anything. We're going to find out exactly what it was they learned, see what they remember about the campaign, see what they liked. Again, the Healthy Kids Colorado survey is a huge tool for us, and I guess it's every 2 years, is that correct? And so actually there's the next sort of report out on that will be from 2017 data, and then again we'll be looking 2 years out from that at the 2019 data to see and continue measuring ourselves against what kids are reporting here in Colorado. The youth convention, I mentioned briefly some of the focus groups, and we've empaneled a group of kids here in Denver to sort of help, not only help guide the development of this campaign, but serve as ambassadors for it once it's out there. And we'll be asking repeatedly this group for their feedback on it. And it's a good mix of Denver kids, sort of a cross section of the city, if you will, and we're really going to be looking to them for their attitudes, their impressions, and their takeaways. And then, of course, we'll be evaluating our media and all the different strategies that we are going to put in place for this. So that is a quick and dirty overview of the high cost campaign that we'll be launching here in Denver shortly. And I'm going to go ahead and turn it over to my colleagues here on the stage.
All right. Hi, everyone. My name is Allison Maffey, or Allie, and I work at the State Health Department, as Dan mentioned. I manage the retail marijuana education program for the state. And I decided to focus a little bit on our youth campaigns as well, but I'm happy to stay after and talk to anyone about some of the broader education campaigns that we have. So a little bit about the State Health Department. We play a lot of different roles related to marijuana within the state, but I think the two most important for our conversation today include looking at data and trends, as well as serving that public health education. Our motto, or our kind of slogan, is educating the public about safe, legal, responsible use of recreational marijuana. And so these campaigns grew out of that effort. So first things first, biggest lesson learned ever is before you launch anything public education related around marijuana is make sure you have good science to stand on. So this very hefty report is released out of the State Health Department. They formed the Retail Marijuana Public Health Advisory Committee. It's broken into 3 sections. They look at use patterns. They look at adverse effects such as like hospitalizations and emergency department visits. And then they also do systematic literature reviews of all of the health effects related to marijuana. And so when we say marijuana is dangerous for kids, we only use information in here about why. If you Google marijuana, you're going to find that it kills you and cures everything. So you need the good science to be able to stand on and something to reference back to. They had certain level of criteria for any messaging that they would use in this, certain criteria for any, messaging is campaigns, for any research that they looked at, is what I meant to say. So there are some studies that are very poorly done that may have significant results on one end or the other related to the health effects of marijuana, but if the study was not well structured, then it's not included in here. So they had pretty high standards for the type of research that they would include, which then, as we know, limits the amount of research you can look at related to marijuana, but we didn't want to make claims that we knew could be proven false quickly. So that's a really big lesson learned. I know it's not really about campaigns, but in a way it really is, because your messaging will be scrutinized all the time. Particularly, I would say our most contentious campaigns are the youth campaign. The social media sentiment that comes back afterwards is, why aren't you saying this about alcohol? It's way worse for them. So that's generally the pushback we get on any youth messaging about marijuana. Well, alcohol's worse. And then for breastfeeding and pregnancy, we get a lot of pushback that no, marijuana is actually good during that stage. So it's really important to be able to have science to stand on. So Dan mentioned the Healthy Kids Colorado survey. Just to kind of put it in context, across the entire state, not just in Denver, we have not seen any statistically significant changes in marijuana use among adolescents across the state in a number of years. So you can see it's remained relatively unchanged. That's also supported by the National Survey on Drug Use and Health. So we're right in line with the national averages. The margin of error is similar across both. So what we know is that 4 out of 5 Colorado high schoolers do not use marijuana in the last 30 days. And that's really important. As Dan referenced, the social marketing and social norming for youth is to say, no, everyone's not doing it. It's also really important for parents. In our focus group was with parents. They would say, when we would ask, how many youth do you think are using marijuana? And they'd say 80%. And then, was your kid using? Well, no. Oh, so your kid is magically part of the only 20% that you don't think is using. But luckily, those parents' perceptions of youth were also inaccurate. It's only 20% of youth that are currently using marijuana. And then what do we know about the impact of adults in the lives of youth? So youth who agree that their teachers care and encourage them are nearly twice as likely not to use marijuana. Youth who know that they can ask a parent or a guardian for help are 1.6 times less likely to use marijuana. Youth who have clear family rules. Their parents have laid down the law at home about what it means to use marijuana and what would happen to them. They are 1.7 times less likely to use. And if a parent feels like underage use is wrong, their children are 4 times less likely to use marijuana. So any youth campaign that we knew we launched had to include that important parent component to educate them to start these conversations, because they're more impactful than any campaign we can ever have. If we only focus on youth, we will not see those kinds of results. So our program includes the social marketing campaigns, community education and prevention, the statewide portal for all information related to marijuana, statewide integration, that's as we work with other, like for instance, the Department of Education to be able to align our messaging, and evaluating our efforts. So we know that effective prevention, and this comes from SAMHSA, the Substance Abuse and Mental Health Services Administration, that social marketing alone is usually not very effective unless it is combined with interventions across the community. So looking at policy changes, looking at community outreach or coalitions, those are often called, making sure that your curricula in schools is reinforcing the same message, and then also releasing social marketing campaigns are really what leverage success in a community. So we do have a lot of information about policies using evidence from alcohol and tobacco and trying to apply those to marijuana. We don't have a strong evidence base yet for marijuana-related policies, but we are trying to work to establish that. With community outreach, our Office of Behavioral Health at the state level funds, they've received about, I think, $4 million that they put out in community grants. And then we have a $9 million program that we fund Communities That Care, which is a community organizing model that is evidence-based to reduce substance abuse. So we fund 48 communities all across the state to implement Communities That Care. Health education curricula, we've been working very closely with the Department of Education to be able to make evidence-based health education curricula available to schools. What's really hard, though, is that the evidence base for all health education curricula was done in a world where marijuana was illegal. So will that same evidence hold true in a world where marijuana is legal? We have yet to see. But we're using the best evidence available to be able to promote those. So with social marketing campaigns, it's always important to make sure that you segment your audience, you listen to what they believe about the issue, you test the message with them, go where they are, and keep listening and adapting. Going to the audience looks like reminding state legislators that they don't see the youth campaign because they're not between the ages of 12 and 20. And that's a hard thing for people. If they're putting money towards the effort, they want to see it, but they're not the target audience. So we often have to remind them of that. Same thing, our Board of Health. I asked if anyone on our Board of Health had seen our youth campaigns, and only the youth advisor that sits on our Board of Health had seen the youth campaign. And I was like, perfect, that means we're doing our job right, because the rest of you shouldn't see it. So our campaign timeline, we've launched a variety of campaigns all under that safe, legal, responsible use. So the first education campaigns for the general public launched in January 2015. That has to do with money. Kind of another lesson learned for those of you who are maybe in states that are legalizing is you can't spend money to educate the public until the money is coming in from the sale, which means you're launching a year after legalization. And so identifying funds early on to be able to launch education, public education, in advance of legalization, really important, wasn't an option for us. And so we have Spanish language, pregnancy and breastfeeding, a few others. But
The legalization of marijuana in Colorado raised a number of questions and concerns among residents, even for those who supported legalization. One of the biggest concerns was whether the availability and normalization of marijuana would increase use among Colorado's youth. The Colorado Department of Public Health and Environment set out to address these concerns by developing 2 distinct yet complementary campaigns. The first was for youth, inspiring them to focus on their goals instead of using marijuana. The second was for parents, teachers, coaches, counselors, and other adults that youth trust, empowering them to have informed and effective conversations with the young people in their lives to help keep them from using marijuana. Our research with Colorado youth showed they were skeptical of health statements about the consequences of marijuana use. Youth rejected preachy tones and scare tactics and were quick to judge content that felt like it came from a biased point of view. We also found that youth believed using retail marijuana underage could get in the way of accomplishing their goals. So, with that in mind, we created Protect What's Next, a campaign that helps youth prioritize and achieve their goals and keep marijuana from getting in their way. Using online ads, we drove our audience to protectwhatsnext.com, where they could use a digital, interactive tool that helps youth discover and achieve personal goals while educating them on how the health effects and legal consequences of using marijuana underage can get in the way of those goals. More than 3,000 youth have started discovering what's next for them by using this tool. We also developed the Protect What's Next Challenge, a statewide student-led competition that introduced youth to the challenges and triumphs of setting and achieving their goals. Working in partnership with 63 Colorado middle schools, we generated more than 15,000 student submissions in just 4 weeks. And we partnered with TEDx Mile High to create Protect What's Next Adventures, a series of 11 once-in-a-lifetime experiences with entrepreneurs and craftsmen from across Colorado. But Protect What's Next wasn't the only voice speaking to Colorado's youth. Our research showed that youth were seeking out conversations about marijuana with adults they trust. So we connected with parents, teachers, coaches, and counselors through our Good to Know Trusted Adults campaign. This campaign delivered encouraging and empowering messages to adults via TV, radio, and online ads, as well as through local community outreach efforts and an original TV town hall in partnership with Denver's CBS4. We even partnered with well-respected bloggers and influencers, producing 28 blog posts to reach our audience with trusted local experts. The campaign drove our audience to goodtoknowcolorado.com/talk, where they could find tools and tips designed to help adults talk effectively with youth about marijuana and also combat misperceptions of teen marijuana use. Data showed nearly 25% of parents were under the impression that most youth use marijuana regularly, when in fact, 4 out of 5 high schoolers do not use marijuana. And 3 years after legalization, current marijuana use among Colorado youth remains unchanged from pre-legalization data. 84% of Colorado parents with teens have talked with their kids about the risks of using marijuana. And we continue to monitor and adapt our message to both parents and youth, ensuring we remain relevant and prevent youth marijuana use moving forward.
All right, so have you ever gone on maternity leave and then come back and your staff put together your slides and you're just shocked by how good they did? Sorry, I just got back from maternity leave. I did not know they embedded that. All right, so anyway, my staff are so great. So you learned a lot about our campaigns, the Trusted Adult and the Youth campaign, and how those complement each other. I have a couple examples up here of some of those resources. What you learned about the adventures from there. The Reaching Youth Through the Middle School Challenge was a really awesome kind of push that we were able to do with Colorado middle schools. I do want to highlight a lesson learned here for us, though, is we avoided, and I know Dan's facing some of these challenges too, of how obvious is your marijuana messaging. And so we did not want to be in any middle school that had an elementary school attached to it, because we didn't want to inappropriately expose too young of children to anything related to marijuana. We also didn't want a high school attached, because we didn't want high schoolers who were too cool for anything poo-pooing middle schoolers' involvement in the challenge. And inadvertently, through those parameters, that meant a lot of rural schools did not get selected to participate in the challenge, because a lot of rural schools are kindergarten through 12 all in the same building. And that's something we did not do enough research ahead of time to make sure, and so we would totally change that type of effort moving forward. So what we've heard from our youth evaluation, we partnered with a program that funds a lot of after-school programs across the state, and they added a couple evaluation questions to their surveys that we could learn a little bit more how youth reacted to our campaigns. And what we saw is that youth exposed to the campaign were significantly more likely to agree that marijuana made it harder to think and do things and would affect one's body and cause cravings. And then we also saw with adults who live with children, they had a statistically significant increase in their plans to talk to children about the risks of marijuana, their perceptions of risk for a teen using regularly, and the perceptions of risk of unsafe storage in the home. The video highlighted that great statistic that 84% of parents say that they've talked to their teen about marijuana. Guess what happens when you ask the teens how many of their parents talk to them about marijuana? It's not 84%. So hopefully through these resources, we're equipping parents and teachers and coaches to have a more blatant and honest conversation about marijuana, where maybe it's not, where both parties know that they're having a conversation, not just the parents. So a few of the things that I brought with me, I have a couple examples from the campaign. I have a couple that you all are free to take from our general education campaign. The purple brochure was from our tourism efforts, and then the green brochure, the little fold-out, is what we currently make available in retail stores to be able to educate users about marijuana. And then I have just singular examples of some of the other campaigns, the parent handouts, pregnancy and breastfeeding handouts. This was part of the middle school challenge. It was a journal for them to capture some of their goals, where they keep hustling, as it says. And then we also have our youth toolkit. This was a peer-to-peer education opportunity for youth to be able to educate other youth about marijuana. Of course, that takes an adult equipped to help them guide them through that conversation, but we also have this youth toolkit, and we partnered with Denver to be able to pilot it in some of their locations, after-school locations, to make sure that it was youth-appropriate and could be facilitated by youth. So these are a few of the things that we have, and I'll be here afterwards if you want to ask any questions. With that, I'll turn it over to Paige.
Well, hi everyone. So Paige McGowan. I work in Spokane County. I actually am a contractor for the Department of Health in Washington State. So I've noticed we've been hearing a lot from the state level at this conference, and I'm going to be speaking about local efforts. So I work for Spokane Regional Health District, and we serve a 6-county region. So we're funded by the Washington State Department of Health to work on youth marijuana prevention. And our 6 counties are considered pretty rural, and overall we probably serve around 600,000 people. In Spokane County, we have about 500,000 people, which is primarily where I work. Sorry about that. So I just wanted to give you a little bit of context for that. And then I'm going to be telling you a little bit about a campaign that we did and the reasons we did it, and how grateful we are for our friends in Colorado who helped us set the tone for that. So a few things here. The reason that we started this campaign, it's called Weed to Know, is because we had a lot of complaints in our community about public consumption, people using everywhere in our parks and playgrounds and our downtown core specifically. We had an increase in calls to the Washington State Poison Center for people accidentally ingesting marijuana and consuming marijuana, kids especially. A lot of concerns from different community partners, coalitions, and the public around driving under the influence, and then just a general misunderstanding of the law and lack of clarity around what's legal. I mean, a lot of people in our state will say, like, it's legal. That's that. So we wanted to do something around education, and even more so, we went and met with our county prosecutor's office, and we talked with law enforcement, and we really learned that although we may not see education as a regulatory issue, it really is a regulatory issue, because our prosecutor wouldn't prosecute DUI or public consumption or any of that because they felt strongly that there was no public education done yet. So people continued to say, we didn't know, or I don't know. And so this really propelled us to use some of our youth marijuana prevention funds to develop a campaign that was actually targeted at adult marijuana users. Also, in our state, we have a youth marijuana prevention campaign facilitated by the Department of Health. It's called Listen to Your Selfie, and it does target youth, but we didn't have anything like Good to Know, and we didn't have anything at all that targeted adult marijuana users or educated any adults about the law. Also, our funding from the Department of Health, it was a little unusual in that they gave us our first batch of funding for what they called year one, which we got, and we had to spend about $250,000 in 3 months. So year one was April, May, and June of 2016. So we got this money and we're like, oh great, like what do we do with $250,000? So we had the funds to be able to do a campaign, and then we also are really fortunate to have an in-house communications department that could help us. So it didn't cost us anything but indirects through our agency, which I recognize that not a lot of people have that, but we have amazing communication people and a graphic designer of our own. So I want to talk a little bit about the timeline. Like I said, we had 3 months total to get these funds spent, so that meant that we had 6 weeks to develop a campaign. The good thing is that we actually met with Allie and others from her team. And we loved Good to Know. We wanted to do something like it because we felt it met the needs of our community. So we talked with them, got permission to use a very similar look and feel, and actually played off the title, Good to Know. And we did do some message testing with several different partners in our community. We have in our agency, we have around 1,000 methadone treatment patients that come to our agency every single day. So we did message testing with most of them report using marijuana. So we did lots of message testing there, lots of message testing in the community. We worked with the Liquor and Cannabis Board, who regulates marijuana in our state, to make sure that they liked the messages and that they could use them as well. We also had the messages reviewed by law enforcement, so we were all on the same page that public health was going to take on this educational approach. In terms of budgeting and funding, like I said, this was funded by youth marijuana prevention dollars to get us started. Now we fund it with local capacity development funds. And for our first wave of media, after we had the messages developed, I'm going to show you the messages in a second, but we had about $28,000 to be able to launch this. Our recommendation from our communications was to do a heavy push on targeted digital, so like web-based and on phones, so it's like the things that pop up and tell you when you're somewhere, like, hey, did you know there's 50% off granola right now? It's like that, except for marijuana users, so we could target people based on if they were frequenting certain websites and stuff. And then that was for the whole month, half of May and June. We spent $28,000, and we placed ads in all of our popular newspapers that reach over 50,000 people in our community. And then we did placements in marijuana advertisement, like magazines and publications, and then we did a lot of targeted digital. And then we did a second wave in October of 2016 through December, and we focused primarily on driving people to the website so they could learn more. And we spent about $16,000 on that. I'll tell you a little bit about the analytics and how that little bit of money and what it got for us so far. We primarily looked at how long people stayed on our website, which the communications people tell me is like a really important thing. So on average, people stay on our website for almost 3 minutes and 30 seconds, which is a lot of time. If you've ever measured how much people are reading your information, 3 minutes is a really long time. It means people are clicking through, they're reading the material. And then our click-through rate was also about 0.09%, which is also very good. So when people saw the ads, they were really interested to click and learn more. So we made sure that our website had a lot of information on it. We also made sure that people could download the resources to use in their own communities, because as soon as we launched this, we got a lot of requests. So I'll show you the ads. If you've seen Good to Know Colorado, it looks very familiar. We came up with 6 ads. One is on addiction. We do have a free 24-hour hotline in Washington State that people can call. It's a recovery helpline. So we wanted to promote that because nobody really knows about it. Everybody knows about 1-800-QUIT-NOW, but we don't think very many people know about this wonderful resource. So we really tried to frame it in addiction and normalized calling and asking for help. We did one on driving under the influence. We worked with our Washington State Traffic Safety Commission and really asked them, hey, what's your recommendation? Should we give to people about consuming marijuana and then driving? And at that time, they said, we don't have one because we don't know. So our message is, if you're high today, don't drive today. And then we also came up with one for educating people about marijuana being unsafe and illegal for anyone under 21. We get a lot of questions about that, like if it's okay if parents give marijuana in their home to their kids. So we wanted to clarify that through a message. And then we also came up with one for safe storage, really promoting, if you're gonna have this in your home, consider it like alcohol or other household cleaning products. So people are kind of getting familiar with, storing it safe and out of sight. That message is really similar to the Good to Know. And then we also did one about talking to youth about the risks of marijuana use. One very engaged adult in a youth's life make all the difference, so we really wanted to promote having a conversation. Don't be afraid of having a conversation, and on our website we have some tips for doing that. And then our big one is this public consumption one, which I'll tell you about the success of that in a minute. So we launched this campaign, and right away we got a really, really positive response from our community. And one of our biggest partners now is our Downtown Spokane Partnership, which is like our business district. they were having a lot of issues with public consumption, and a lot of the people who are using in public are people who hang out downtown most of the day, some of the people who are not permanent residents of Spokane, just passing through. Also a lot of youth coming down from our high schools that are near our downtown core and consuming with adults in the community. So it's not good for the image, not good for law enforcement. And they called us and said, what can you do? How can we work together? So we ended up coming up with this rat card. So this is on the left side is a front and back, and we put all 6 messages on the back. And we partnered with Downtown Spokane Partnerships ambassadors to actually talk with people when they would see them using marijuana. Instead of just ignoring it, going up and talking to them, offering resources and educating them in a non-judgmental way. And right away, our captain of our downtown precinct, he came to us and said, I want my officers to participate in this, because we can't just keep issuing tickets because people don't pay their tickets, and it just doesn't change behavior. So anyway, we did some training with law enforcement, and the downtown ambassadors on our law enforcement now approach people and actually talk about marijuana use, and they point them to the hotline, and they just have an opportunity to assess for that person's overall well-being rather than just issuing them a citation or ignoring it altogether. The one thing that we have done some emphasis patrol on with our law enforcement is adults consuming with youth. We've done some education of the school that this is happening. We gave them a heads up that law enforcement were going to really be looking at this, just because it is a really serious issue that we need to educate about and we need to enforce. And then this little sign on the right-hand side, it got brought to our attention that there's all of our smoking in public places law signage that are required at all doors that open of all of our businesses, but there's nothing that talks about marijuana and public consumption. So our businesses in our downtown core requested signs that they can put up on their businesses and help educate people, like it's not okay to step outside and smoke a joint outside of Macy's. So anyway, we printed these. They're clear window clings. They just go on the inside of a window, and they've been really, really popular, and popular for our schools have picked them up and started using them. Law enforcement, some people have, law enforcement have put them in their vehicles, like on their cars even. So they were, really organically developed, but have become a nice resource in our community. And then our downtown Spokane businesses also have started putting posters in their businesses, like the bench one about public consumption has been really popular. We enforce the smoking in public places law on the business. So if they're allowing smoking indoors or within 25 feet, they're the ones that get a civil fine. So they recognize that it's in their best interest to educate their customers that they can't light up right on their patios or outside, and definitely not inside. So that's just some of the success of launching this. And the other thing that we've really focused on doing is in our county of about 500,000 people, we have 34 retailers. So this campaign, we started going to each and every retailer and talking to them about it, and so far I've only had one out of all of those businesses tell me that they didn't want the campaign in their store. That business, they own 3 stores, so that's a tough one to crack, but they just don't see it as profitable, and they don't really see themselves in prevention, and that's been really interesting to learn about their perspective and learn about how our messaging doesn't reside with them. But for everybody else, they have the rat cards and posters that they give out to customers. They usually put them on their like on the counter, but some of them put the rat card in every single customer's purchase. So they're really trying to make sure that their customers are complying with the law and that the industry can be successful because they're not known as people who are driving to the influence or giving to minors or using in public. So that's been really interesting, and retailers just request it. So some things on outcomes. One of the things that I wish we could go back and ask for way more time and way more money, we never did a baseline assessment of education in our community. So we don't really know what the perceptions were. We don't really know what people's knowledge of the laws were. We work very closely with our community, but it would have been nice to do some sort of baseline to be able to do evaluation now that we've had the campaign implemented for over a year. But we do have some outcomes that have been really positive. And through our efforts with the Downtown Spokane Partnership, we were able to decrease public consumption in the downtown core, and that's all counted by every single time an ambassador or law enforcement observes public consumption. So we were able to see that decrease in the summertime, which is actually it's when everyone's hanging out outside, sitting on patios, walking around downtown. So that was really positive. And this spring, law enforcement contacted us again and said, can we partner again? So that's really positive, and I think we're going to be able to grow that relationship a little bit more. And then our region, we have healthcare providers, WIC, coalitions, businesses, of course, all the retailers disseminating it. And what I love about the campaign, We to Know, is that we just haven't really got any pushback. People are more interested in what's coming next because they want to be able to give this messaging out. You know, we've got a couple emails here and there from people about, you know, we actually get similar sentiments, like you should focus on alcohol and stuff. But with regards to the campaign, we really haven't got any negative feedback, which everything else we do, I get emails that I'm like, sorry. So this has been really positive, and I consider that a big win. And then because we were the first in our state to do this, we've had requests for these materials from across our state. So our Department of Health is actually working on launching an adult marijuana prevention campaign in the next year or so, but they still don't have it. So we've been sending this out, and it's actually used in King County in some places. So that's really exciting because they do everything before us. So we're really proud of that. And then, of course, our analytics. So we're just really proud that people continue to come to the site and get education there. So a couple of next steps for this campaign. Oh, I skipped ahead on my slide, sorry about that. But we're going to continue disseminating it to retailer stores because we've actually launched the second batch of this campaign, which I'm going to talk about. We want to evaluate this. If we can get some more funding to do some sort of evaluation, we'd like to do that. And then possibly following Colorado's suit and possibly modifying the campaign to work on actual behavior change rather than just general awareness and education. But we're going to need some resources to be able to do assessment on exactly what our messages should be. And then we've also talked a lot about possibly doing some social norming campaigns targeted at adults, because we know about misperceptions of use is that they become a risk factor for use. So when parents perpetuate that everyone's doing it, that's something that we could work on correcting that misperception and closing the gap between actual use and just people's misperceptions. So the exciting thing about this campaign is that people really wanted it, and one of the audiences that didn't feel like they had all of their needs met with the original campaign is healthcare providers, and talking to pregnant, breastfeeding women and then parents of young children. So we have a birth outcomes task force that serves our county and several counties in our region, and they approached us and asked if we could partner and expand the campaign. So this was, again, ahead of our State Department, so we did coordinate with them, and we know that they're about to launch a campaign actually this fall, but this was over last fall and winter, so we actually launched ours in the spring of this year. So we may transition to the state's campaign, or we may continue using our own. But we came up with 3 new messages, one for pregnancy, one for breastfeeding, and one for parenting. And they're exactly the same in terms of the layout. Like, they are all a little poem, and then they have a message. But we changed it from the who, what, where of responsible marijuana use to recommendations for pregnancy, breastfeeding, and parenting. So we also have a website for this. People can go and learn a little bit more, and we direct them to resources. These are all posters, and they're all those little rat cards. And on the back of the rat cards, when we message tested, we learned that healthcare providers really wanted 3 bullet points. So on the back of the rat cards, there's 3 bullet points pertaining to each topic, so that a healthcare provider can quickly grab the resource and have a conversation with a patient. So this was mostly disseminated through anyone who serves children and families, state agencies included, our WIC offices, and healthcare providers throughout our region. And this, again, was requested by our partners in King County. So we know that we've filled a gap that is temporary in our state, but nonetheless, it was really important for us to do this message. We tested these again with pregnant women, specifically women who are marijuana users. And what I found most interesting about that is we didn't get any negative feedback. They said, we need to have this conversation. A lot of them disclosed that they'd used marijuana during pregnancy. to cope with morning sickness, and they really want to know more information, but and a lot of them it's something that's been passed down as generations. Like they say, oh, my family did this, or my brothers and sisters do this, and nobody's had anything bad happen to them. So they were all really supportive, and we really didn't get any negative feedback about this. Funny enough, we are a public health agency. When we launched this, we got more pushback about the conversation transition to whether or not we should be promoting immunizations in our community. So we were like, oh, nobody's paying attention to me to know. They're all just mad at us about us telling them to get their flu shot. So overall, it's been pretty successful, and maybe we'll add to it, maybe we won't, because the state's going to launch their campaign. This one, again, we had people spend over 2 minutes on our website, and also had actually a higher click-through rate than our original campaigns. When people saw this targeted digital ad, they were really likely to click and learn a little bit more. So on here, I just put both websites, so if that's of interest to you, go ahead, click on the link, and then you can download the resources. So we print them on like a cardstock, but they're all there. We've tried to make them really accessible for anyone to use, and then if this is something that you're interested in using in your community or in any of the groups that you work with, we want to make sure that that's easy for you to do. So you can shoot me an email and I'll connect you with our communications department. They'll just help you come up with some text to make sure we attribute the graphic designer that we use. But otherwise, it's something that we want to make sure is a resource for others. So I'm happy to answer questions or share more about it after as well. I think I'm going to turn it over to Sam.
Good morning, everybody. My name is Sam Cole. I'm with the Colorado Department of Transportation, and I oversee the development and implementation of our campaign to raise awareness around the dangers of driving high. One of our important partners, our creative agency, is in the audience here from Amelie, and they have been instrumental in helping us roll out this campaign. And I think they would agree this has just been an amazing and incredibly fun campaign to work on. I never really had an interest in the show Mad Men before I started working on our campaign, and now it's my favorite show. And sometimes I think of myself as Don Draper, but But that being said, this is a really, really serious issue. Driving high is killing people in Colorado, and it's no small task that we need to stop the trend, and we need to reduce the number of fatalities that we're seeing. We get a fairly small amount, only about $450,000 of state marijuana tax money to roll out this campaign. That only allows us to be in market for a month or two, for the whole year. The good news is the state is going to be doubling the amount of money that we get. We'll get close to $1 million in 2018 to raise awareness on this issue. The health department and Allie's campaign, they really don't talk much about this. She's, and I think it's a great relationship. She talks about other things, and we just have a single campaign around driving high that we've rolled out literally since within a few months of the first recreational stores opening in Colorado, which I found really remarkable. So let's begin. So before those recreational stores opened in 2014, we made sure to do some focus groups just to find out what was going on in the heads of marijuana users. And they told us basically four things. They thought there were different penalties for drugs versus alcohol when it came to driving and getting a DUI. They didn't even think the laws were in effect. They didn't think that marijuana really applied to the DUI law. They thought that marijuana was safer to use and drive than alcohol, and actually they still really do believe that. It's a real problem. And that they wouldn't respond well to a heavy-handed government message. So tactics that we've used over the year include paid advertising, partnerships with dispensaries, the Marijuana Industry Group, rideshare companies. We've used guerrilla tactics or PR stunts basically in the community to really produce some good earned media stories for us. Of course, the target are people most at risk of driving high, and that's males 21 to 34 years old. The way we measure success in the program is through a driver survey that we roll out every November in Colorado. It goes to all drivers in the state, but there's usually about 100 who self-identify as marijuana users. And then we ask them, how often do you drive high and that sort of thing. We do a pre and post survey around our campaign just to find out if people saw the campaign in market. We measure this by the number of paid ad impressions, the number of news stories we're getting about our campaign. We look at the engagement on social media. And of course, we look at the fatality data and the DUI arrests. And I'll just take a pause there and look at that. And it's going up. This is where our huge concern is, especially if you look at that the bar chart there on the right. Those are crashes, fatalities that involve active THC. Only active THC can cause impairment, and 77 fatalities involved active THC in 2016. And of those 77, 51 actually were at or above our legal limit in Colorado, which is 5 nanograms. And just to give you some perspective, that 51 is about 8% of all fatalities in the state. And also to give you more perspective, about a third of our fatalities are related to alcohol. So not as big of a problem as alcohol, but still a growing problem that we are really, really concerned about. So back to our campaigns. When we first started launching this campaign, we looked at this process of behavioral change to figure out where people were. And it became quite obvious that they were really in the awareness and learning stage. They really needed to know what the DUI law was, and they needed to know more about the dangers of driving high. So kind of some of the guiding principles that we've used for the campaign is that, yes, users do not want to feel criminalized, that we would take a neutral stance rooted in education, the law, and its dangers as we rolled out these campaigns, and that we needed to connect to users and get them to trust us. I mean, the year before was, heavy-handed government, you can get arrested for possessing and using marijuana, and now everything's okay as long as you don't drive high. And so there wasn't that trust with government. So messaging coming from government has proven a little challenging. So our initial approach to advertising was to educate people. Very simple, that you can get a DUI for driving high. Our tone was, you can do a lot of things. You can bake a cake, you can mow your lawn, you can wash your dog, but just don't get in the car and drive high. So we called it Drive High, Get a DUI, and we made it humorous and lighthearted. This is one of the ads from the beginning. So, this does not look like an ad that you would see from a government agency, which was the whole purpose of this. But since then, we've really kind of taken more of a serious approach to our ads. These are some billboards that have gone up near dispensaries along the Front Range, showing crashed cars looking like marijuana joints, showing a grinder with a crashed car in it. This is an ad targeting the Hispanic community. If you light this one up, don't light this, don't start this, don't drive high. So much more serious, and but we still want to have a little bit of fun. So we developed this ad, which ran online.
19% of DUIs in Colorado are for marijuana. Why? Because marijuana impairs reaction time. Reaction time is important, as proven by the fact that you can't catch this skip ad button. Marijuana decreases your reaction time, making you an unsafe driver. If you're high, don't drive.
So definitely more of a serious approach than that first video that we saw. Then talking about these guerrilla tactics and stunts that we've done in the community, this has been a really important effort to produce some news stories and getting the news interested. The first two vehicles up there, that's our hotboxing car. We retrofitted it with a smoking machine. We would take it to ball games or downtown Denver or 420 events and just park it. And then remotely, with a little remote across the street, we'd turn on the smoke machine. And the car would start to fill with smoke. The windows were a little bit cracked open, so the smoke would start to come out, and people kind of thought people were getting high in there before the concert or whatever. And then the smoke dissipates, little fan comes on, and in bright neon, drive high, get a DUI. People just kind of were blown away by that. So it was always a big surprise. Then we also did this bottom one was called the slow speed chase, which we wrapped two vehicles. One to look like a cop car, and the other one to look like every marijuana user's dream car. It had a big marijuana leaf on it. And we just drove it slowly, very slowly around concert venues and 420 events, just to drive home that message that, yes, law enforcement is trained and they are going to arrest stoned drivers. So don't think that they won't. We also had fun with some of the dispensaries putting these arcade games. We took these old arcade games and retrofitted them. You walk up to it if you're in a dispensary and you think, oh, I want to play this racing game. But we retrofitted it with this message. It says, CDOT reminds you, playing video games while high is legal, driving is not. Please pick a non-driving game, basically. So kind of a tongue-in-cheek way of reminding people they shouldn't be driving high. We also did a cannabis quiz cab near one of the 420 events. We had this Jenga block set with all sorts of marijuana messaging on it at another event. So just diving a little bit deeper into our most recent campaign for 2017, this is kind of how our budget would divide up. A significant amount went to digital outreach because you can get so targeted with digital if you're trying to reach marijuana users. And then we did a lot of out-of-home with some of these billboards located near dispensaries, as well as getting posters and that sort of thing in dispensaries. And of course, not forgetting about the Hispanic audience. About 20% of Coloradans are Hispanic. It was a partnership with Lyft. We launched the 320 movement, just like 420 is about having a good time for marijuana users. We wanted 320 to be when you plan for a ride. We wanted 320 to be now known for safety, planning a ride. And so Lyft partnered with us, offering discounts as an incentive for people to plan for a safe ride if they're getting high. They wrapped 17 of their vehicles. 17% of DUIs in Colorado are related to marijuana. And so leading up to 420, this is just a great way to remind people about and actually drive people towards behavior change. We're kind of hoping that now they know about the law, now they know about dangers. We're kind of hoping now they'll be ready for some behavior change to actually plan for a safe ride, but they're not entirely there yet. So we promoted this 320 campaign. We had a website with all sorts of data on there on the dangers of driving high. You had to go to the website in order to download the discount Lyft coupon. And then we drove people to the website with different digital banners. A lot of these digital banners were geo-targeted in dispensaries. So if you went in a dispensary and you're on your phone, this ad may come up reminding you about the 320 movement and the Lyft discounts. I talked a little bit before about the stunts that we're doing. One of them involved this crashed edible. This was a 500-pound half crashed car, half edible. And then we had a street team right there too. You can kind of see the side of the table. We brought this to various events, the concert here at Method Man in Redmond, at Red Rocks, up in Morrison, 420 on the block party. Bringing this there, getting people to, it's such an eye-catching thing, getting people to engage about the dangers of driving high, especially edibles, when people aren't really familiar with the fact that your high won't hit until an hour or two after you do the edible. And that could be a real recipe for disaster if you're driving. The other tactic, you cannot go anywhere in Colorado and find a 420 road sign because they're highly coveted. So we thought, what a great idea to hide some of these, we had 100 printed up, just kind of miniature 420 road signs, and we hid them at various marijuana events, and then we pushed out on social media, hey, take a look for the road signs, and if you find one, bring it to our street team, and we'll give you a discount for riding Lyft. And it also allowed our street team to engage and educate people around the dangers of driving high. And again, we did this at 420 events, the concerts, any event that we thought was going to be popular with marijuana users. And then this is a window cling that appeared in a lot of dispensaries, 130 dispensaries across the state. Plan a ride before you take a hit. 17% of DUI arrests in Colorado involve marijuana. And we did, as I mentioned, a lot of targeting on social media. This is kind of how we targeted people following people with these interests, is how we targeted dispensaries, bars, cannabis. Because you can't just go on social media and say you want to target marijuana users. That's I think, pretty impossible to do. But if you target these interests, you can pretty much get to them. And then we pushed all this messaging out on paid ad and organic posts. A little bit of a sample of the feedback that we got from people. They really did like the campaign, especially the mile marker campaign, and they really did engage with us around some of the messaging around the dangers of driving high. Engagement rate of almost 4% is really high. So that's way above industry average. And click-through rate of 1.5% is also very high. So people were really, really engaged with us. They thought our creativity was spot on, and we had lots of likes, shares, comments, and that whole thing. So, and this produced a lot of earned media, which adds a lot of value to this campaign. You know, just over 100 stories online from the tactics that we did last summer. That has a value of over $1.5 million. So we were just really pleased with that. It was just great free advertising for our efforts. And then also some of these handouts in dispensaries. You know, with every purchase, you would get this little flyer taped to your bag about the dangers of driving high. And then for dispensaries that had video capabilities, they might have a screen advertising their latest product. A lot of dispensaries actually have given us permission to run these ads.
I actually drive better when I'm high.
You know, it's really the relationship with dispensaries has been great. You know, it's bad PR for the marijuana industry to see fatalities increase. So they really want to educate their customers, and this other one is also pretty good.
The police can't tell that I'm driving high.
So having those loop at dispensaries has been really, really great. So some of our achievements, and then I'll go over challenges, and then I'll finish up. So yeah, lots of digital impressions, over 35 million out of home and digital. 3,800 people redeemed or retrieved the discount codes from Lyft. Lots of good presence at our events. Other achievements, 91% of marijuana users now know that you can get a DUI for driving high. And this is a general population, so this is very high. 46% awareness of our campaigns. A lot of people knew, a lot of people saw our taglines and our campaigns in market, so that's really encouraging. Challenges, even though people know about the law, it's not changing their behavior. It's not leading to safer choices. Over 50% of marijuana users say they've driven high on an average of 10 times in the last month. Fatalities are increasing, and so are DUIs. So our recommendations from our Highway Safety Office: first and foremost, get your data in order. Make sure you're tracking active THC and your fatalities even before legalization, so you have a before and after comparison, as well as in your DUI arrests. Make sure to identify funding, where that's going to come from, to train law enforcement, to roll out your public education campaign, hire very qualified advertising experts such as Amelie, and do your proper research and of course, develop trust with users in the community. And that's it. If you want to see my slides or any questions, that's my email address, although I think we might be taking questions now. Thanks.
All right. Well, we would love to entertain some questions if anyone wants to get at us. Any takers? All right, I'll throw one out there. Oh, there we go.
What avenues did you utilize to determine your baseline of where the community stood on how they, in understanding the law? So you mentioned the importance of data.
The law around DUI? Yeah. It was our survey that we did every November that goes out to drivers across the state. And then marijuana users are always a subset of those. We've been doing that survey for many years. So.
Anyone else?
Can I jump in there, actually? So we did a survey as well that reinforces his results. We have a panel of adults, about 1,500 adults across the state, and similar results when we were testing knowledge of a variety of different marijuana laws.
Hi there. What do outreach organizations need from stakeholders like dispensaries in order to flourish and be successful in the community?
I think we can probably all address that, but the relationships with industry have been huge. I mean, that is obviously where our audience is as consumers. They're in these stores, especially for out-of-state visitors. There's a lot of education that can happen in store. And I think what's been really fun and nice to see is both the state campaign messaging that's been developed as well as city level stuff that we've provided to industry to use. They have not only utilized that, but they've developed some of their own stuff. They like to have maybe some branded materials and things like that. As Sam mentioned, they're the last ones that want to see irresponsible use by their customers. It's going to reflect really poorly on them. But we have to build that relationship, and we have to provide them, again, with credible information that they're going to be willing to share with their users.
Yeah, we even have somebody from the marijuana industry group on the DUI task force, which is a very high-level government, governor's office task force on DUI in Colorado, and somebody from the marijuana industry is on there. So, yeah, reaching out to them has been really key.
Same with us. Our Marijuana Education Oversight Committee includes representatives of the industry, the medical industry, these fine gentlemen. But I think for me, the biggest lesson learned was trust building with the industry and users. It wasn't popular at first to have messaging targeting users directly. It was more, well, everyone needs to know that. But really, who needs to know about safe storage? Not the general public. Users need to know about safe storage. Things like that. So building trust with the industry, with users, that we were a credible resource, that government wasn't just going to wag our finger in their faces related to marijuana legalization. And then I think another part of that relationship is that you should be a little more delicate with was tourism. The tourism, for good reason, Colorado has really great reasons to come here, not just marijuana. And so how do you reach tourists specifically with information on what the laws are? They don't know when they come here. Seth Rogen posted, like right when legalization happened, one of his movies was going to be screened at a theater, and he was coming here for it, and he's like, everyone come get high with me at the theater. And it's like, yeah, that's illegal. You can't do that. Just because we legalized doesn't mean you can do anything. So how do you reach them in a very narrow window without advertising marijuana as a reason to come? And that misperception when you start adding your ads in there to people who are planning a trip to Colorado, it's delicate.
So this is a question for Sam. Those are some impressive statistics. 212 million impressions is a lot. 90% of people aware that DUI is, you can get a DUI, that's great, but it hasn't affected the behavior at all. What are you going to do next?
So we are looking into some new tactics. This next year, we may kind of abandon the traditional ad campaign and do more of a community engagement campaign across the state where we have digital town hall meetings, real life town hall meetings, bringing in partners from all walks of life, bringing in the general public, really elevating the conversation to get everybody talking about this, about why people are driving high, what sort of misinformation do they have, what would it take for us to convince them not to drive high. So it's going to be kind of a classic PR public engagement campaign.
Back when I was in college, my roommate borrowed my car and went out on the highway, and he was stoned, and he was going like 35 miles an hour on a 65-mile-an-hour highway, and someone smashed into the back of my car thanks to that. And it just makes you wonder, is there like some typical way that traffic fatalities involving marijuana unfold that are different than traffic fatalities involving alcohol?
In a way, yes. I mean, there's the myth that people who drive high are driving slow and are being careful, but in reality, that's not true. That you talk to law enforcement, they are driving recklessly. They are endangering themselves. They're endangering other people on the road, and their perception of time, distance, and speed is very impaired. So when they pull into an intersection and they look down the road, that car may be a lot closer that they're about to pull out in front of. In fact, I know there's happened in Denver last year. A guy higher than a kite pulled out into an intersection, didn't realize how close the car was coming down the road, and T-boned him, and his girlfriend died. I think some of this does happen. Maybe this is just a guess of mine, that maybe people do drive slower, or there's a perception that they're driving slower when they're only mildly high. That's just me thinking, like, I could be totally wrong about that. Maybe it's the people who are higher than a kite that are driving recklessly. I don't know, because I hear both things. But you talk to law enforcement that's investigating the crashes, and they say these people are reckless and they're speeding.
From a research standpoint, in that big manual of all the research they've done, don't quote me on this, but it's something, alcohol increases your risk of a fatal crash something like 10 times. Marijuana only doubles-ish your risk of a fatal crash. And so people say marijuana is safer than alcohol. It's like, it's not safer than sober. You're still doubling your risk of a fatal crash. And so comparing those two substances is really dangerous. And then many times people don't just have one on board, they have both on board, which is, what's the word I want? It magnifies the impairing effect. It is exponential. When you have both on board, you're more impaired than either alone. And the research does support that.
I have another question, curiosity. How do they measure active THC?
It has to be done through a blood toxicology test.
Oh, they have to draw blood? Yeah.
Yep. Yep. There's no roadside device that we have in Colorado to measure impairment caused by marijuana.
Hey, one thing that came to my mind is that sometimes consumers don't have a ton of education about the proper ways to use cannabis and the laws around cannabis, except for at the point of sale if they're not familiar with the laws. I had chatted with a retailer about what advice do you give your customers about where to consume cannabis, and they literally told me, well, we know it's not legal to consume in public, but the police don't really enforce it, so that's what we tell them. And I was thinking about ways to maybe combat that without being too pushy, and they already have literature at the front that they're required by the state to have. So I guess, rambling question, but my question is, how is it, in your view, the best way to engage with business owners to kind of articulate to them it's important, that they play an important role in educating consumers, and not that they have to, but that it would be great if they could, to get striking that balance? Do you have any advice on how to start engaging with that?
So in Colorado, they're actually not required to have any literature at point of sale. A lot of them do, again, for the exact same reasons of, they're invested in a safe, legal, responsible message. And that's a really hard one. So we have a responsible vendor program within the state that tries to educate vendors how to talk about cannabis at point of sale. It includes how they educate on the law, things like that. But they're not required to do any of that. There are pros and cons. Sometimes requiring doesn't necessarily improve, when there's not really teeth for enforcement, doesn't improve what's happening actually at point of sale. But that's the exact same problem, as Paige pointed out. The law of no public use doesn't really work unless someone enforces it. If everyone knows no one's enforcing it, and a lot of times they aren't enforcing it either because they don't think the public knows, or I've heard from a lot of law enforcement that they don't enforce it because there's no legal place to use. And so if we haven't given homeless people, if we haven't given tourists, if we haven't given, renters an option, if their landlord says they can't use at home, then where else are they going to use? And so, or it might be a tourism thing. We don't want to give tourists a really bad experience by getting a ticket while they're in the state. And so enforcement is really the biggest challenge. And so doing that community work to figure out why is enforcement not happening, and then how can we then actually speak with authority of these are the laws and here's why. And for a lot of our communities that are doing Communities That Care, for them it's about changing community norms. We don't want using public because we don't want kids to see it. Who cares if it's legal or illegal? That's why the law was originally passed. Who cares if you're going to get a ticket or not? It was passed because we don't want it modeled in front of youth. And so that's the direction they're taking more than enforcement.
I think it's a turnoff for dispensaries to hand out government-branded information. So we are now working with dispensaries saying, the best person at a dispensary to talk to you about the dangers and proper use is your bud tender. So we're trying to train bud tenders. We're trying to get dispensaries to actually talk to customers about this. But we're also, giving them kind of a blank slate on putting out collateral material and just saying, if you want to just take this basic information and we'll help you just brand it. So it looks like it's coming from you. It looks like this flyer is coming from you and not from a state agency. They're really receptive to that. Even helping them develop a web page on their website devoted to safety that looks like it's just from them.
We've also done, given those tools to the enforcement officers themselves, whether they're police officers patrolling for public consumption, or bringing in volunteers as part of the police department to help kind of distribute that information in our problem areas, so to speak. The other thing is we gave our park rangers here in Denver authority to write those public consumption civil infraction tickets, but their first step in any engagement is going to be that education piece before they go to that. So it really takes everyone, I guess, is the answer there.
I would just add, at the local level, when we started our Weed to Know campaign, we went and met with some retailers, and they wanted something that was nice and presentable for their storefronts. So we have these, they come in just like a plastic holder with rat cards in them. They want them to be fairly small, and they wanted it to be so easy. So we actually call them and ask if they need a refill, and we go there and drop off materials or mail them. Like, we make it so that they don't have to do anything except make them available. So taking the work out, they already have so many things that they have to regulate and be aware of, that the easier the better.
I just have a quick question since Department of Transportation is here. I'm curious what kind of enforcement issues you're seeing in the airports in terms of especially tourists coming and then leaving after shopping, if any?
Good. I can't speak to that, but Dan can.
So yeah, Denver International Airport's obviously our main hub here, and there is essentially an amnesty policy in place where people are encouraged to get rid of whatever they have before they travel. And people do get caught with it at security, also in luggage checks. There have been 0 arrests for it at DIA. So obviously we're talking about small quantities. The first step with people is education, get rid of it. We're not detaining folks for small amounts. And the number of infractions, I think it was like 50 the first year and another 20 in the bag checks. So it hasn't been a huge problem. People leave it behind in their hotel rooms. People leave it behind in their rental cars. So we work with those agencies on education as well. But so yes, people are traveling with it, but it is not something where we're detaining folks.
The Colorado Springs Airport has a drop box, so it's actually a locked box on site, so you can drop all marijuana in the drop box securely on your way out of the airport.
So is there advertising for the consumer at the airports?
No. No, there's not. And the international airports are governed by the FAA, and so we've got some hurdles there.
The tourism offices will say, there's a tourism office on the way out, I think it's the one out I-70. They get a lot of weed left at their door front as people are driving out of the state, seriously, and they don't know what to do with it. And then they're concerned that then they're in violation of state law because they're possessing more than an ounce because it's being left there. And so people pretty much know the law. We've had to do a lot of education with service industry because of it being left in hotel rooms. You have non-English speakers seeing a bunch of candy that's still sealed, left in a room. So there has been some instances of overdose, some instances of unintentional exposure for youth, where a non-English speaking hotel employee will take the product home and give it to their children, not realizing that it's marijuana.
And those industries, how do you advise them to dispose of it if they're left behind? Like, for example, our hotel industries in our areas.
Open it so that it's not sealed, and throw it in the trash where it's not visible.
So there seems to be a lot of, this is a DUI question, there's a lot of alcohol apps and brochures and how you can tell if you're intoxicated for the public. Is there any apps or is any, how much is safe to consume for the cannabis consumer that is available?
No, not that I'm aware of. And the science is so far behind alcohol on this. I mean, even the 5 nanogram limit for Colorado isn't really an evidence-based limit. So, no, I mean, the tools that we have for alcohol, we don't have for marijuana.
Some of the research, for example, that has been done is done on much lower concentrations than what's currently available in the market here, and is usually only done on more novice users, not experienced users. So we have general times. For instance, it can take 4 hours after consuming edible products to reach maximum blood concentration. So then how do you tell someone when it's safe to drive after eating if it can take up to 4 hours till it reaches maximum blood concentration? I'm trying to find the exact ones, but using over, I think it's 15 milligrams for a novice user does significantly impair their driving, would test positive, but again, that's just novice. And so when your anatomy, male versus female, you metabolize differently. It really depends what you've eaten and how you metabolize just based on the chemistry, like high fat content foods, how it's absorbed into the body. I don't know of any. Do you know of any about dosing and dose response?
No. But I'm sure there are. I'm just not familiar.
Yeah. I think it's Maryland that's done a lot more of that, dose response to impairment. But I don't think of the studies we're funding within the state, I don't think that's.
Mm-hmm.
Good morning. Thank you all for your time. I saw a lot of your campaigns, your education campaigns focused on youth. Does any of your campaigns touch college campuses, or do you guys have a relationship with the college campuses in reference to your education? And how do you go about rolling that out to college students?
That's a great question. So the CADE, College Alcohol and Drug Education, I believe is what that stands for. They're also on our advisory committee. A lot of campuses do their own advertising related to drug and alcohol, so they haven't consumed as many of our resources as much as they try and use their own messaging, their own avenues to be able to disseminate that information. It's really quite tricky, the nuanced laws. It's a drug felony to give marijuana to anyone underage if you're more than 2 years older than them. And so with the ages of college students, there's just some really tricky nuances to educating about the law. So CADE receives funding from our Office of Behavioral Health, which they use for some of their own campus level education. We do make all of our resources and materials available to them. We've placed ads in their newsletters and on campus when we're approached by them, because we want it to work within what they're already doing for alcohol and drug education, and not trying, with our state budget, trample on their, the work that they're trying to do at that local level on the campus. So it's much more of a partnership in that way.
I think at the end of the day, it really does come back to that education, and it made me realize that while the science is also a bit unsophisticated, still, so are the consumers, and so we need to continue encouraging people to start slowly with edibles and concentrates and be careful in their usage. So thanks to my co-presenters here for being here today, and thank you all. We've got a lunch break for the next hour and a half, so go outside. I think it's another beautiful day, and breakouts start up again at 1:15.
If you'd like any, you can steal some of our retailer education and tourism and clinical guideline link.